Typically, about 90% of hair follicles are actively growing new hair. However, with the onset of hair thinning, this percentage drops to 80% or less. This decrease in the number of follicles producing new hair coincides with an increased level of a hormone known as dihydrotestosterone, or DHT. DHT disrupts the normal hair cycle, causing hair follicles to miniaturize and consequently produce the shorter, weaker hair that is characteristic of thinning hair. In the continued presence of DHT, hair follicles may keep shrinking until they no longer produce hair and permanent baldness results. However, if hair follicles are stimulated in earlier stages of miniaturization, they may regain size and return to producing. Before learning about the Haireone Clinical Laser Unit's ability to reinvigorate hair growth, it is important to understand how hair grows. Hair follicles extend through both the dermal and epidermal layers of the skin and are responsible for producing hair. Projecting into the base of each hair follicle is a structure called the dermal papilla, which is composed of rapidly dividing cells and small blood vessels. These cells are packed together in the hair follicle to create a new hair shaft, which pushes out and replaces the old hair shaft after it has become detached from the dermal papilla. Typically, about 90% of hair follicles are actively growing new hair. However, with the onset of hair thinning, this percentage drops to 80% or less. This decrease in the number of follicles producing new hair coincides with an increased level of a hormone known as dihydrotestosterone, or DHT. DHT disrupts the normal hair cycle, causing hair follicles to miniaturize and consequently produce the shorter, weaker hair that is characteristic of thinning hair. In the continued presence of DHT, hair follicles may keep shrinking until they no longer produce hair and permanent baldness results. However, if hair follicles are stimulated in earlier stages of miniaturization, they may regain size and return to producing strong, thick hair. The Haireone Clinical Laser Unit is designed to stimulate miniaturized hair follicles with low-level laser energy. A laser concentrates light waves of a specific energy into a beam of colored light. Humans can see a range of energy as colored light, known as the visible light spectrum. The Haireone Clinical Laser Unit emits light from the red end of this spectrum, which has been proven to stimulate body tissues to increase cellular energy. This increase in energy enhances cellular processes such as growth and eliminating waste. It may also reduce the inflammation surrounding miniaturized hair follicles, allowing these follicles to take in more nutrients and restore their normal size. The Haireone Clinical Laser Unit stimulates hair follicles in transitional and resting phases of the growth cycle to complete these phases more rapidly. Once these phases are complete, the hair follicles are available to take part in an actively growing phase, which is stimulated to produce thicker, fuller, shinier, and healthier-looking hair. The Haireone Clinical Laser Unit contains low-level laser energy diodes in an open-paneled hood. The hood is designed to deliver low-level laser therapy to the entire scalp simultaneously. Each laser is angled to spread out the beam of light it emits in order to create a laser energy field. This laser energy field fully covers the entire scalp, penetrating through the hair and skin and into the hair follicles. An added benefit of dispersing each laser beam is greater safety. When laser beams are spread out, they become less dangerous to sensitive body parts such as the eyes. Due to its beam dispersing technology, the Haireone Clinical Laser Unit has the safest rating of all laser devices used in the hair restoration industry. Also, whereas other low-level laser energy products provide treatment through concentrated, dime-sized laser spots, the laser energy field created by the Haireone Clinical Laser Unit provides full, consistent coverage over the scalp, giving its users a dramatic advantage. Haireone Clinical Laser Units are located in supervised medical facilities. Your physician will provide LLLT sessions that vary in length from 15 to 30 minutes. The frequency of your sessions and the duration of your therapy program will depend on the LLLT package your physician recommends. Programs typically range from 6 to 12 months, with approximately 2 sessions a week. The clinical unit therapy sessions provide full scalp coverage for longer periods of time than other low-energy laser devices, therefore they produce more dramatic results over shorter periods of time. Research is showing that, regardless of the user's age, gender, race, or hair color, the Haireone Clinical Laser Unit works best on scalp areas with thinning hair, where there are miniaturized, yet active hair follicles. It is not designed for use on receding hairlines in the temple area or for severely bald areas of the scalp that no longer grow hair. This device greatly improves hair volume and texture, and adds hair thickness and strength, effectively enhancing the quality of the hair. The Haireone Clinical Laser Unit has been found to be very effective in women, because they typically have more existing hair and more widespread thinning than men. Men with early stages of hair thinning also notice excellent results, and individuals using other hair restoration treatments and procedures, such as hair transplants and hair loss medications, have found that the Haireone Clinical Laser Unit can improve the quality of the hair regained from these treatments. The Haireone Clinical Laser Unit is an innovative, painless, and convenient treatment that revitalizes thinning hair. It has been shown to produce more dramatic results over shorter periods of time than other low-level laser energy devices. Although results differ from one individual to the next, Haireone Clinical Laser Unit users typically notice less hair falling out within 4 weeks. The typical user also notices their existing hair growing fuller, thicker, and healthier within 12 weeks, and notices new hair growth within 6 months. Discuss your particular pattern and degree of hair loss with a hair restoration professional to determine if the Haireone Clinical Laser Unit is the right hair restoration solution for you.